How can treating frown lines save your life? Well, I believe that there is a way, and it's a very important part of the context of how to make a human being healthier and happier over a lifetime. To understand this, we need to understand what faces are for. They are for building relationships and collaborations. So if you have a frown line that is persistently there that makes other humans think that you're cross when you're not, you can see how this could disrupt human connection. And human connection is an important part of health and longevity. If a patient attends with a frown line, they are often not concerned about the crease so much in their skin as they are concerned about looking cross when they actually don't feel cross. And this is really hinting at the underlying problem, which is humans want to convey the correct messages. If they're feeling a certain way, they want that to be how they are perceived. And if there's some sort of miscommunication, it creates a disruption in their ability to form and maintain relationships. Let's have a look at how to treat a particular frown line so that we can make this clearer for you and your patients. This understanding for me started with my first ever patient. She was 92 years old. And I remember when she booked in, my first thought was, there is nothing I can do to make her look younger. And that's what I thought my job was back in those days. But she helped me immensely by sharing a really important insight into why she wanted treatment. She had arrived on the bus that day and wanted to have more conversations with people that she was meeting, but she felt like she looked angry when she was not. She felt a lack of confidence in terms of approaching people and had the perception that other people would not approach her. She was therefore getting lonelier and struggling with that as she got older, as unfortunately so many people do. You can see how this situation could make her less likely to have that friend available. Say, for example, one day if she couldn't leave the house and she needed some shopping done for her, she might have met someone on the bus who would have helped her solve that problem. Human beings need each other to survive and collaborate, and that's really what our faces are designed to do, to help us connect and collaborate. It was this patient who helped me realize right at the start of my career the importance of both the psychology, how the patient feels, but also the ability for other people to connect with them, the social context. Those are really the domain of health that aesthetics works in. And if you want to help your patients live longer, happier lives, it will really help you to understand the psychosocial context is so important. If they understand it, your treatments also make a lot more sense. And this is why I really want everyone to know this. A patient who comes to see you for a line does not realize until you explain it to them what their instinct is trying to help them do. It's trying to help them build relationships so that they can survive. If you can help them see that, your recommendations will make a lot more sense. So what will we do about a simple frown line? Before we dive in, make sure you subscribe if you want to learn more about how to optimize human health and longevity. I'm a family physician and an aesthetic doctor, and I actually think it's all one and the same. If you want to learn how to optimize your own health, or if you're a clinician especially who wants to do this for other patients, then check the description for more in-depth learning. This patient came to me in her late 40s, and this was her first ever treatment. The average age of a patient in an aesthetics clinic is always around 43. And this is really when aging starts to become much more apparent to the average person who isn't actually looking for signs of aging, but is aware of a drift from their natural state that starts to disrupt a sense of identity and connection with what they perceive to be their true self. So Karen had felt this disruption and had seen an opportunity to try and soften some of these lines so that she could look more how she felt on the inside. Now, when assessing frown lines, it's really important to understand the severity and depth of the frown line because there are so many different ways of treating them. Most patients in their early 30s with a light frown line don't even need a full botulinum toxin treatment for that to improve. You can sometimes get a great result just by increasing moisturizing and using better skincare can actually improve fine lines and wrinkles at a young age. As that line becomes more part of the skin, treating with a muscle relaxant like botulinum toxin will allow most lines to completely disappear, even if they seem quite ingrained. By the time the line has actually formed a three-dimensional shape, so in the case of Karen's frown, the line, if you looked at her head from above, you would see a three-dimensional curve and a dip that is different to a crease. And these lines need something more significant, so a dermal filler can be placed underneath the line so that the three-dimensional shape of the labella no longer has a furrow in the middle of it. So the reason I treated with both botulinum toxin and dermal filler in Karen's case is because I needed that combination. I knew that relaxing the muscle on its own would not unfold the shadow that she was noticing. And if I just used a dermal filler, that I would have to then retreat more often because the muscle is strong enough to reform around that wrinkle. So the combination is the best formula. In fact, if you use dermal filler once, you may never need to treat again so long as you use botulinum toxin on a regular basis. There are, of course, treatments you can do on the surface of the skin for skin quality, and we're going to cover that in depth on a future episode. Treating frown lines with dermal filler is somewhat out of favor because of the awareness of blindness as a potential side effect. Now, I believe you can break down every technique into multiple different steps and make all of them as safe as possible, decreasing the overall risk to what I perceive to be negligible. Now, what you'll see in my technique here is multiple steps being used to keep my patients safe. The most obvious of which is I'm injecting away from the eye. I'm also compressing where the arteries are located. She also fortunately has a central crease, which is much less likely to be near the arteries, which often reside directly underneath two lateral creases that form more commonly. So she's got many elements in her favor. I'm also using a light product superficially with multiple steps, multiple aspiration techniques, and I ultrasounded before I did the treatment. All of these together, I think, put her in a very safe position to have the procedure, which may only need to be done once in her lifetime if she has botulinum toxin on a regular basis. Clinicians often ask me which order to do treatments in. I always prefer to do dermal filler first and botulinum toxin afterwards, because I do think injecting dermal filler around toxin is just a little bit more likely to cause a pressure effect and disrupt where you placed it. And it seems easier for me to place botulinum toxin at the end and then leave the patient to get the end result. In terms of botulinum toxin technique, you'll notice me injecting at different depths as I inject along the corrugator. We do multiple additional steps to make sure that the patient is defended from spread of botulinum toxin, particularly into the orbit, where you can, of course, cause a droopy eyelid. So pressure around the orbital rim, the correct depth, an angle that makes it more likely that you're in the middle part of the corrugator supercilii rather than above or below it, or superior or inferior to it. All of these make it more likely to get the toxin where it needs to be to relax the muscle with minimal side effects and an efficient use of product. It's also worth varying your dose depending on the strength of the muscle that you see and the desired result. So in Karen's case, she has a moderately strong glabellar complex. She might use slightly above average units. 24 units would be quite common to use in an average aesthetic clinic with a patient who's slightly above average, who wants a complete stillness of the glabella. If you really want to accelerate your career in aesthetics, make sure you pay attention to what your patients say about the whole experience. Karen shared with us a really interesting experience, which is first, she was enjoying using makeup more because it was so easy to apply it without having to worry about the lines that had been treated. She also had a bit of a negative experience because her partner thought that she looked like a bit battered and bruised after the procedure. She had a full face treatment at the same time, and she got what is quite common with treating the glabella, which is a line of bruising directly underneath the crease. This is partly down to what I believe to be a safer way of doing the treatment, that you slide the needle in and out, but it can cause bruising, but she had been warned about that before we did the procedure. Patients are much more relaxed about bruising and side effects when it has been discussed with them on the day, and then they can handle it with their partners when they go home. When you don't do a good consultation, the partner can cause a lot of uncertainty, and then the patient comes back worrying. So this was an example of how good communication helped Karen feel confident about her procedure and the normal recovery process with her husband without feeling concerned that something was wrong. What I also love about Karen's story is that she expressed much more confidence in her day-to-day activities. She is a personal assistant. She deals with people over Zoom a lot, and being free of the concern of that frown line, which had been there for as long as she can remember, was one of the things that was giving her a lot of joy on a day-to-day basis. And it's this interaction with the world that we're really trying to augment and make easier for people. When you understand that's what your job is, you'll see the value that you generate all over their lives when they tell you the stories of how life is after the treatment. This is all part of optimizing a human to have better social connections and ultimately to feel healthier, to get on better at work, to form better relationships, and even to live longer. If you want to see this full 2.5-hour procedure and learn a lot more about human health and longevity, see the resources in the description.